From giving someone their daily medicine to checking their blood pressure or dressing a wound, district nurses are the vital link providing NHS healthcare in people's homes. But it's a service under strain. A district nurse for 30 years, Gilly now has a special role supporting people at the end of life. So she sees the huge workload of the ordinary district nurses.
And they, the nurses, don't have the time to have an in-depth conversation about death and dying. The whole timing doesn't allow them to have some of these really in-depth conversations with patients who may have come home, really not fully aware that they are dying.
In 2010, there were more than 7,500 full-time district nurse posts in England, but in 2016 that had fallen to just over 4,000. Today, a report into NHS rationing concludes the workforce shortfall is now critical, meaning district nurses are increasingly rushed, which may damage patient care. Kaz Sayer decides how NHS money is spent in Camden, North London, and she says investment promised to community nursing often ends up shoring up hospital finances.
A lot of that investment has gone to upholding performance within the acute trusts, which tend to have a much higher political profile.
So this is one of our inpatient rooms here at Royal Trinity. We have 28, but actually about 80% of what we do in the community.
At the Royal Trinity Hospice in South London, community outreach workers funded by charity donations are taking over some of the work of local district nurses.
What we're seeing is that district nurses are referring patients to us that maybe they wouldn't have done in the past because they would have had that time to spend. And now they're making referrals because they need help. Everybody wants a good death. Lots of people wish to stay at home for that death, and therefore it is our pleasure to do that, but it is obviously a draw on our resources as well.
The NHS's key aim right now is to treat more people in their own homes. But that's an aspiration currently undermined by a lack of investment in the nurses needed to achieve that. Catherine Jones, 5 News.